It may feel hard to believe, but in a matter of months, we will mark 3 years since the first case of pneumonia with an unknown cause was reported to the World Health Organization. In that time, lives, laws and liberties have been turned upside down by what we now know to be SARS-CoV-2. Officially, the global death toll is on track to surpass 6.4 million people, although the WHO estimates the pandemic has resulted in a staggering 15 million excess deaths. Although 3 years in, countries are now approaching the virus in vastly different ways. The virus, of course, originated here in China, where there's an aggressive strategy of containment, shutting down cities, creating makeshift hospitals and locking away citizens. Shanghai's 25 million people have recently emerged from a 60-day lockdown as Beijing continues its campaign for COVID-0, as much of the world is reopening. It says just 5,000 people have died. The health response has flattened its enormous economy, driving concerns of a world recession. Next to South Africa, where the highly contagious Omicron strain first emerged. It's seen the greatest number of cases and deaths in Africa, more than 100,000. As vaccinations increase, its fifth wave is now declining, and the government has repealed all restrictions and isolation periods. The success of the UK's response is contested, with more than 181,000 people dying with the disease. The British government under Boris Johnson implemented hard lockdowns. Now any requirement to isolate has been dropped altogether. Britain's economy is rebounding, construction and manufacturing are up. Inflation, though, has hit a 40-year high in May, leading the Bank of England to warn it could actually reach 11% before Christmas. No economy, though, is more dominant than the United States, and it's passed more than 1 million COVID deaths. Here, a 5-day isolation period is recommended, but not mandated. With inflation dangerously hot, rates surging and demand slowing, the economy is teetering towards a possible recession. By contrast, Australia is in enviable shape. The most recent government report shows 348,000 active COVID cases nationally, but only 5,000 or so of those cases were actually in hospital, a rate of 1.51%. Despite that, we're still required to isolate for 7 days. Government support payments have been extended and mask mandates remain in certain locations. The flu, comparatively, has seen 187,000 cases to July 3, with more than 1,300 people admitted to hospital and 113 associated deaths. The peak of Australia's Omicron wave will arrive in coming weeks, but right now this country isn't loosening the restrictions.